And for those who just joined, I've explained that if you need to leave early at any point throughout today, feel free to do so. We will be sending out the recording directly to you, so you can always catch up at a later time. So today we're covering flexibility and mobility exercises, and I hope that everyone managed to have a look at Sean's webinar from last week, who covered strength and endurance, and that's some really good insight because exercise in general is your number one treatment for arthritis. It's the most important thing we can be doing to manage it. And different exercises have different benefits for the management of this condition. So it's really good to have an overall understanding about what we need to be doing, but why we also need to be doing and how it helps your joints.
That should be
So
okay.
just kindly asking everyone to make sure your microphones are on mute. I can help out with that. I will begin with just a brief acknowledgement of traditional owners. We acknowledge the traditional custodians of the land on which we gather today. We pay our respects to their elders, past and present, and recognize their continuing connection to our land, waters, and culture. Now, I do begin also with a disclaimer just to let you know that all the information we pop into these webinars are just for your general understanding. It's not to supplement any individual treatment advice. So if you do have questions that relate specifically to your individual condition and your treatment plans, I will always direct you to your primary healthcare provider. I'll do my best to help out with any questions on this topic today. I'll ask kindly that everyone pops them into the chat group, and that's just so at the end of the session, we can open up the forum, we can revisit some of those questions that pop up and pass over the mic so we can have a bit of a discussion on this topic as well. So today we are covering flexibility and mobility. We're looking at the benefits of those and why they're so important to us with arthritis. I will give you some direction about some of the simple activities you can be doing on a daily basis to yield those benefits, and some bonus tips as well. So I did say that to anyone who's going to be frantically writing down notes in their notepad and trying to retain all this information, we go through a lot of points. And so that's why in the post-webinar email, you'll get a copy of these presentation slides. Feel free to send us through any questions you might have in addition to that. So why don't we begin with just a general overview of what flexibility and mobility is. Your flexibility exercises, they're also going to be referred to as your stretching activities. They're specifically aimed at improving the range of motion of your joints and muscles. So if you ever feel very tight and stiff within your muscles and your joints, these are the type of exercises that can help with it. These exercises target your muscles, your tendons, and all the connective tissues within that. So they're designed to help the muscles stretch, lengthen, and contract without limitations. So they're meant to help allow for smooth and efficient, pain-free movement. When we get older, a real natural part of the aging process is that our flexibility tends to decrease. And I'm sure some of you can relate to that. You've noticed change in your ability to move. So by doing these stretching exercises daily, we can actually improve that. These type of exercises are used extensively in the rehabilitation context. So if you've undergone any kind of joint replacement surgery, any kind of surgery in your musculoskeletal system where there's been an injury or a disease, these exercises will be used to help give you that motion specific to given joints. So the goal of these exercises is to really regain that normal range of motion and improve our functional abilities. And when we can do that, we can have such a better quality of life. Mobility training is really all about improving how freely and comfortable your joints and muscles move. So these exercises are intended to help make everyday movements like walking, bending, reaching, even just turning or getting out of bed much easier and much more efficient. Okay. So, what does the research actually show us? Why is it important? And essentially, it's because we know flexibility begins to decline as early as age 30 in men and age 40 in women. So, women are able to retain their flexibility a little bit longer than men. But on average, we have data to suggest that flexibility decreases by 0.8% per year in men, 0.6% in women. So this decline isn't exactly what we call uniform across the body. There's certain joints that lose flexibility faster than others. So if you're thinking about the way your body is moving, you might have noticed certain joints have, like the shoulders and trunk, has lost its flexibility. Um, and this has impacted on maybe your posture or reaching and rotation. Some of us might have experienced it in the elbows and knees. So, elbows and knees, generally speaking, can maintain mobility better over time. But this is likely due to less demand for large ranges of motion in everyday use. So we don't use these as much as what we actually use the shoulders and trunk. So people with osteoarthritis, they experience significantly more mobility limitations than those without the condition. And we have data that suggests 61% of people with osteoarthritis report difficulty moving outside the home, compared to just 10.2% of people without osteoarthritis. If we're looking at this within the home, 12.8% of those with osteoarthritis experiencing mobility issues, compared to only 2.8% of people without the disease. That's a huge gap. So that's something to that's some background as to why we want to make sure we're also thinking about flexibility and mobility in our treatment plans. So, when we talked about strength training, it's really important to reiterate just why general exercise and training is important if you have any kind of musculoskeletal limitation. So, not just arthritis, but maybe it's chronic back pain, maybe it's fibromyalgia, um, or an autoimmune disease. So, sarcopenia is an age related loss of muscle mass and strength. It actually occurs to most of us. We see this decline begin to impact us within our 40s, but it can be accelerated with inactivity or illness. So, this decline can impact things like just standing from a chair, carrying your groceries. It can increase the risk of falls, of fractures, and hospitalization. The causes of this are very multifactorial. There's no one cause, but you can have the genetics, you can have inflammation, maybe it's insulin resistance. But the thing we know that corrects this, the thing we know that works to fight this, is regular movement, resistance training, and flexibility exercises. Osteopenia is what we call reduced bone density. So this heightens the risk of fractures, particularly falls. As we get older, our bones naturally weaken. So we can do things to preserve that strength, like improving flexibility, balance, coordination. All these things are very crucial to fall prevention. Inflexibility, which is age-related stiffness and reduced range of motion. These are often due to collagen loss, particularly within our connective tissues and the tendons and ligaments. This can limit mobility and increase injury risk as well. And then you have something called proprioception. So this is basically your body's sixth sense. It's your body's ability to sense position and movement without visual cues. So almost your GPS for balance and coordination. Things like aging, medications, and neurological changes can actually affect this, but it can be improved through targeted balance activities, strengthening those muscles, and flexibility exercises. So these are all things we can challenge through those exercises. And basically, your takeaway here is that staying active is going to be the best defense for maintaining your independence, reducing injury risk and enhancing your quality of life. So, just to add on to the benefits of flexibility training specifically, the main benefit we have is the enhanced joint mobilization and the improved range of motion. And this is because these type of exercises help promote something called synovial fluid production within the joints. Your synovial fluid, I want you to imagine the joint capsule. Um, you have two bones. At the end of the bones, you have cartilage. That fluid is absolutely essential to nourishing the joint tissues, and it's the compression and release, that movement of fluid in and out of the cells, which is essential for feeding the joint and keeping it healthy. So pretty much when we get that fluid moving in and out of the cells, it's delivering essential nutrients. So this is what's going to keep your tissues nourished. It's going to help fight stiffness. When we have arthritis, a lot of us think of it as being a disease of wear and tear. It's the loss of the cartilage, but it's also a disease that affects the change of fluid within your joints. So when this is compromised, this is what can lead to things like your joint stiffness, decreased mobility. So your flexibility exercises is what's going to help stimulate that production of the fluid. So this is going to help with greater joint lubrication, smoother joint movement, just better general range of motion. There are a lot of other benefits as well with preventing injuries, falls, fractures, preventing muscle fatigue. But in the context of arthritis, the effects of muscle inflexibility on joint stability is particularly significant, and I'm sure some of us can relate to that. Muscles surrounding your joints play a very crucial role in providing that stability. So they're there to help protect the joints from injury. They're designed to absorb shock and force when you're moving. But I guess over time, they can tighten, they can become inflexible. So this can really compromise the ability of the muscles to adequately support and stabilize the affected joints. So when that's affected, it can pull the affected joint out of its optimal alignment, can become less effective at absorbing shock and force, which is why sometimes when you're moving, you can feel that a lot more in your joints, can lead to increased stress on the joints and then high risk of injury as well. So some people can unconsciously adopt compensatory movement patterns as well to complete tasks or activities, which can lead to inefficient movement mechanics. So, for instance, someone with a sore knee might lean more on their other leg to avoid putting too much weight on um, uh, uh, the painful one or the affected joint. But this is why with mobility or stability, flexibility exercises, it can help improve the alignment of our joints. So flexibility training can help restore proper muscle length tension relationships. It can improve the elasticity of muscles, connective tissues, and reduce the need for compensatory movement patterns. So overall, this is how it helps reduce that soreness and pain we get from movement and exercise. And of course, I can go on about the benefits of mobility training, like improving posture as well, strength, balance, self efficacy, and balance control, reduce fear of falling, increase confidence, walking speed, physical function. But we'd probably need a whole webinar just allocated to those benefits. There's extensive ones. So I did mention that you will be getting notes on these. You'll get a copy of the presentation so you can retain this. You can practice it in your own households every day. But enhancing flexibility is really all about creating consistent, gentle habits that improve your range of motion over time. So if we look at what the American College of Sports Medicine recommend, they recommend stretching each major muscle group, so the neck and shoulders, back and spine, hips and hamstrings, calves and ankles, wrists and hands, at least 2 to 3 times per week. But they do note that daily stretching is what's going to yield the greatest benefits, particularly in older adults, and if you're trying to get on top of that joint pain. Now, Regularity essentially matters more than intensity. So it's really about that consistency in the practice that's going to give you the greatest improvements. So we have studies that have shown that holding a stretch for 15 to 30 seconds, repeated 2 to 4 times, is going to be most effective for increasing flexibility and building that range of motion over time. When you hold each stretch for about 15 to 30 seconds, it gives your muscles that opportunity to lengthen and adapt. So when you repeat this 2 to 4 times, it gives the muscles time to gradually release the tension and rest briefly between each repetition. Now, there is a difference between static and dynamic stretching exercises, with again, both delivering different kinds of benefits, all which are important. And the names are pretty self explanatory. So, static exercises really involve holding a stretch in a fixed position for a period of time. So, that's your 15 to 30 seconds. And it's holding this without movement. Dynamic is what involves movement-based activity, and it involves repeated rhythmic motion that improves your strength, mobility, endurance, coordination. Thing to remember is that flexibility, it builds slowly. So even if it's just 10 minutes a day that you begin with, um, this can really give you some amazing results. There are some support tools for this, and I'll hold off on that until we get to the slide that covers those. But I mentioned dynamic stretches are really important because they are intended to help prepare your body for movement. These type of exercises are what's going to increase your blood flow, warm up your muscles, which is going to be pretty important in winter time if you're feeling that stiffness, and improve that joint mobility. So we have just some examples here. There are many dynamic stretches that are out there, but leg swings, which is swinging one leg forward and backward in a very smooth, controlled way. Arm circles, rotating your arms in a very small to large circular motions, whether it's forward or backward. The cat-cow stretch. If you do yoga or Pilates, you'd be familiar with this type of stretch, but getting on those hands and knees and alternating between the arching of your spine. So dipping and lifting while lifting your chest and tailbone. Walking lunges. And this could be with or without support, but stepping forward into a lunge, lowering your back knee toward the ground, then pushing off and bringing the back leg forward to the next lunge. These are all exercises that can help with things like loosening hips and legs. So if you feel the stiffness, particularly within the joints of your hips and your legs, leg swings are going to be really beneficial for you. If you feel it more in your shoulders or your trunk or your neck, then arm circles. Cat-cow is really going to be beneficial for mobilizing that spine and core. And then walking lunges is what's going to help, particularly with those load-bearing joints, the hips and knees, and just generally improving balance. So these are best done during your warm-up activities if you're getting prepared to do some more intensive exercise, or they're just good to do if you're in the household and you're feeling a little bit stiff. They're pretty safe to do and run a pretty low risk of injury. Just letting some people in. So stiffness, reduced range of motion, pain, we know these are really well established barriers to exercise. So not only are yoga, Tai Chi, and Pilates really safe and low impact activities, but they're backed by a lot of research and recognized approaches for improving flexibility, mobility, and just overall functioning of your body. So this is going to be particularly relevant if you have those goals of improving your general functioning from day to day. In 2015, there was actually a study that looked specifically at 75 sedentary adults aged 18 and older, and they were diagnosed with either rheumatoid arthritis or osteoarthritis. So, in this study, participants were randomly assigned to either an 8-week yoga program or a waitlist control group. The yoga program is consisted of two 60-minute instructor-led classes, one home practice session per week, modified poses tailored to the individual needs. And this was to ensure safety and accessibility. And although it was your physical health being measured, they were able to note there were benefits in other things like walking capacity, mood, depression, levels of flexibility, and just overall health related quality of life. And the yoga group experienced an increase of 125 minutes in the 6-minute walk test. Balance and grip strength were similar between the groups, but the flexibility improvements were observed strongly in the yoga group. And these benefits weren't just achieved at the end of the 8-week session. They were actually sustained at the 9-month follow up, suggesting that these activities are really good for those long term benefits. So, if you want those long term solutions, they're the activities to look at. If you are someone who experiences a lot of discomfort when going to exercise, using supportive tools like your foam rollers, massage bowls, and stretch straps, even those heat-based topical products, so the Physiocrem or Voltaren, those kind of topical creams, if you need it, can help prepare your body for movement, reduce discomfort, and improve that joint function over time. So foam rolling, it does use gentle pressure to target tight or overactive muscles. So if you feel a lot of tightness, this might be something that helps release that tension and improve that circulation to stiff areas. So this is really important if you have a restriction in your joint motion. You want to make sure you're avoiding any compensatory strain. So this could be a tool to look at and um, explore. Massage balls help with accessing harder to reach areas. So between the shoulder blades or under the feet. And they can assist with maintaining safe and effective stretch positions. So this is going to help with improving that precision and control, especially if you have a weakness in your grip strength or limited flexibility. And then applying warmth before activity. So this is going to be important for getting that blood flow, improving it, reducing stiffness, and priming the joints and muscles for movement. So this is particularly important if you're about to do a more intensive exercise session. This is all about loosening those connective tissues and helping with reduce that resistance in tight or inflamed areas. So this could be particularly beneficial in the morning, especially if you're someone who struggles with that morning stiffness. Um, or if you're someone who exercises later on in the day and you struggle with stiffness after all these activities you've done during work or at the end of the day. So, stretching and mobility exercises, they're generally safe to do, but it's all about proactively managing the risks as well. This is really important for maintaining function, independence, and mitigating any risks that could come about from inappropriate preparation. And so, really, by now, I do hope that most of us are familiar with the idea that it's about gentle and gradual progression. So, this is essential, especially if you're working with stiff joints or chronic pain. Pushing into pain is notorious for triggering those flare ups. It's number one cause of inflammation or compensatory strain. So instead, moving with a comfortable range, even if very small at first, it's going to help not only with preventing injury, but maintaining that confidence and encourages consistency. Your gentle movement also allows tissues like muscles and tendons and ligaments to adapt safely over time. So, building flexibility and mobility, it's a long-term process and it's not something that comes overnight or very quickly. It's something that requires that consistency. So, you might want to begin with only a few minutes of stretching or simple movement, but you will know as your range begins to improve when you can gradually increase that intensity or frequency and complexity. And this progression is what's going to be key for ensuring things like joint alignment, muscle balance, and movement control, all which is really important for reducing that direct stress on your arthritic joints. So we have research that suggests it takes actually around 30 hours of targeted mobility and flexibility work to see any kind of measurable lasting improvements. So that could translate to 15 to 30 minutes a day for 2 to 3 months, or 2 to 3 sessions a week over several months. So it's really important to be realistic about the time frame in which you can see the benefits. And it takes time for your body to adapt to new movement patterns, but it's like an investment. It's really important to listen to your body and make sure you're preventing injury, and the benefits will come. So some of the principles to really follow throughout is to make sure that you're protecting yourself. So know the difference between pain and progress. Discomfort, all exercise kind of gives you that little bit of discomfort. You would know this if you do regularly exercise. But if we're talking mild muscle soreness or stiffness, that can be a normal part of building strength and mobility. But there's a difference between the pain that becomes sharp, stabbing, or worsening. And that would be what we immediately call a red flag. You always should stop if pain increases during or after. And again, it's about listening to your body. So knowing when to stop exercising, because you might need to actually speak to your doctor or physio or exercise physiologist. Exercise shouldn't, increase pain in a bad way. You can use a pain scale in this. If it's good to aim to stay at a 3 or below during movement-based activities. If the pain rises above that level, it's a very strong indicator to modify or stop the exercise altogether and seek out advice or help. If you live with an inflammatory type of arthritis, having a flare plan is absolutely essential here. So if symptoms worsen, rest and reduce aggravating activities. Use gentle range of motion stretches to stay mobile. You can apply heat or ice depending on what helps your joints and what you usually do to give you that relief. But resume exercise only once that pain and inflammation has settled. And it's a good idea to work with your rheumatologist to discuss exercise regimes and stretching. And if your goals are to enhance flexibility and mobility, it's a good idea to speak to your rheumatologist about that. So all these points here really reiterate why it's really been beneficial and important to work with a physiotherapist or an exercise physiologist. We know that physios can help everyone with arthritis, and a key to success in training is making sure that exercise is tailored to you. It should be what we call person-centered. So if flexibility and mobility is a weakness of yours, you can be sure that you'd benefit from getting a personalized plan based on your condition, your goals, and what your limitations are. And it's all about ensuring that safe progression. So by working with someone who's qualified in this area, you can get the correct guidance to know what's normal, what's not, what's good pain is, what bad pain is, and gradually build that confidence in movement, because there are a lot of long-term benefits that we've gone through that can be derived from exercising more. So if you haven't already and you have an inflammatory type of arthritis, I hope you've been able to see Clara, or you've come across it. It's an app that we've designed for people with rheumatoid arthritis specifically. It's an easy way to navigate and see what programs and services we have at our organization, and it can give you more insight to the exercises that are going to be beneficial for your condition. So it's one of those things that can help with ongoing management. Now, I can see that a lot of questions have actually come through the chat group, so I'm going to start circling back to those. We hold on for just 1 second.